Hello, my name is Paul Pazen, and I have the great pleasure of being the police chief here in Denver. We're here to talk about our approach to developing an alternative response program that really focuses on getting people, particularly people in crisis, the help that they need, utilizing the best source for that help. How this works for our department is it's really built on our strategic plan. Our strategic plan has a focus on reducing social harms, the social harms that are impacting or some of the underlying causal factors of crime. Mental health, substance abuse, fear of crime, and multimodal transportation safety issues. Mental health and substance abuse really have a significant impact on some of the crime challenges that we face. And if we are able to take a public health view to address those concerns or those issues, then it gives us a greater opportunity for success in keeping our city safe. Now, our city, much like others across the country, have seen dramatic increases in workload, whether that be through increased in population or increased activities in downtown areas, whether that's a daytime population coming into work or a overnight visitors that are visiting and taking a look at our city, or folks coming into our entertainment district to have fun. The workload has increased dramatically. However, the increase in police resources has not matched that population and workload growth. Now, we also noticed in reviewing the data that we were seeing an increase in mental health related calls for service. Since this slide, we've actually seen this level off, which is a great thing. But this helps spur the conversation of, if we have a greater increase in calls for service around mental health related calls, how can we better meet those needs or the needs of our community? So you see at the top of the slide here that this is an and approach, not an or approach. It's critical that we recognize that. The focus should be on people in crisis and making sure that we get better outcomes for individuals that are in crisis. And in some circumstances, it's better if a STAR type program, which matches a mental health professional and a medical professional, respond to that call without law enforcement responding. So our programs are really three-pronged. If somebody is in crisis and they are armed with a weapon or they are violent, then the most appropriate response would be a co-responder, which pairs a mental health professional and a police officer. These are higher risk calls where we work to de-escalate the situation, but you still have a police officer or police officers on scene to help prevent any escalation of violence or use of weapons. Akin to this program is our STAR program, which now pairs the mental health professional with a paramedicine professional, and these are lower risk calls where the individual is not armed or is nonviolent. Again, we do not want to send mental health professionals or medical professionals into a situation where they could get hurt. However, if we do not need a police officer to respond to these lower level calls, one, it aids in the outcome of that particular incident, and two, it frees up law enforcement to address that increased workload of a growing population, as well as growing workload demands based on the previous indicators that we've seen. Lastly, in this public health or this continuum of care approach is our outreach case coordinators. So in Denver, if Paul is in crisis and I'm armed or violent, then a co-responder would respond, work to de-escalate the situation, and get me to the appropriate resources. If Paul is in crisis, unarmed, nonviolent, STAR would do the exact same thing without a police officer being present. They would work to de-escalate the situation and get me to the appropriate resource. But where these outreach case coordinators or these case managers play a critical role in this is, what about the person in crisis next week or next month? Ideally, we are providing that continuum of care where we are outreaching to individuals and making sure that they are accessing the available resources and they're getting the support, so that way that person is not in crisis a week from now, a month from now, or beyond. And this approach has really helped to get better outcomes for people in crisis, as well as a long-term sustainable approach to help people and meet their needs. Quickly, our co-responder program, again, it's a mental health professional paired with a police officer. Currently, we have 37 mental health clinicians throughout our city. We have expanded this from the beginnings when we only had 4. We recognize the value in being able to de-escalate these situations, and it's our objective to have a mental health professional or a co-responder available 7 days a week, 24 hours a day, regardless of district. You never know when that crisis interaction could take place, and having co-responders widely available paired with our officers has led to better outcomes. Again, only 2% of all encounters have resulted in a arrest or citation, which has been very good. And as far as complaints or service to the community, no complaints, and there's been exactly 0 impact on our budget, which is critical when the workload is increased and our staffing has not kept up with those workload demands. Our outreach case coordinators, they started 1 month after our STAR program. There is a case manager assigned to each one of our police districts. That way, for example, over the weekend, we had a crisis situation where a person was armed, threatening suicide. It was successfully de-escalated. The person was able to get the assistance that they need. That happened in Police District 4. Now the outreach case coordinator from District 4 will follow up with that individual, because it's great work that took place with our negotiators and our tactical teams to de-escalate that situation. But we don't want to have to go through that again. And the best way to address this is through this long-term support. And similarly, it's a 0 budget impact for us when we don't have enough police officers to address the violent property or traffic safety issues that we are facing. It's critical that this is not an or, that we are funding outreach case coordinators, case managers, or STAR program folks, or police officers. It's an and. We are staffing both of these. Here's a quick look at what this looks like. The case managers get their information from the STAR program, for example, from folks in the field, like our community resource officers, our homeless outreach officers, other co-responders, to feed that information, so that way anybody that is in need, or any officer on a burglary call that comes across somebody in crisis, can then have the case manager, the civilian case manager, follow up. And then similarly, we have a lot of resources available in the city, both city resources to include nonprofit resources. And so that's where this case manager, without having to deal with 911 calls coming in or other workload demands, can focus on getting the long-term sustainable support that an individual may need, whether that be housing, whether that be youth services, whether that be additional mental health services. The case manager then can do that warm handoff and directly connect people to the resources that exist within the city, as well as the nonprofit resources. Our case managers have gotten people jobs. They have gotten people housing. They have gotten people furniture, for example. They have helped if it's a repair of a vehicle. So whatever the need is, they work with the other city entities and nonprofits, faith leaders, in order to meet the needs of that person that is or was in crisis, so that way we can prevent future crises from taking place. The part of our program that gets the most attention is the STAR program. The STAR program was launched. We have coming up 18 months, or about 18 months worth of data on this. And this is built on that foundation of the co-responder program. But we also studied cahoots in Eugene, Oregon, in order to help us identify how we can accomplish this in our city. But again, this involves pairing a mental health professional with a paramedicine professional and responding to those mid or lower level crisis calls where the individual is not armed with a weapon or not displaying any violent types of behavior. On this particular slide, we talk about the community involvement, and there was a lot of partnership in getting this launched. First and foremost, Caring for Denver is how we're able to accomplish this without an impact on the budget. There is a ballot initiative that was passed that provides about $36 to $40 million annually to address mental health and substance abuse issues. We applied for that grant program. We were able to launch the STAR pilot for 1 year at a very reasonable rate of about $200,000. Since then, we've been able to sustain or create long-term budget for an expanded STAR program. Many of the partners that we utilized, nonprofits that have dedicated themselves to providing outreach and support to our community, as well as city partners here, and individuals with lived experience that were able to share their experience, things that had happened to them, to help guide what this STAR program would look like. One of the areas that we are working on, we hope to launch this in the next couple of months, is our assessment intake diversion. This fits into the model. So whether the person was contacted by a police officer, by a co-responder, potentially even by the STAR program, if we have an individual that, for example, is involved in shoplifting because they want to feed their family, that's much different than some of these organized retail theft rings that we are seeing across the country that are targeting high-end stores. An individual that is in need would be assessed prior to booking. It would focus on their individual aspects of what's taking place, and if it meets the criteria, they'd be directly connected to additional support systems, and they would never step foot in the jail for that particular crime. We would connect people in need to a diversion prior to custodial arrest in the city jail. So working on this, but again, this is part of the evolution of this continuum of care and trying to meet people where their needs are. Again, we talked a little bit about the Aid Center. We're a couple of months from getting this up and running. We do have the space, we do have the partnerships, we do have some of the staff that are identified, but the overall goal here is to divert individuals that are in need of services that can avoid the criminal justice system altogether, connect them to long-term mental health supports, and really provide a focus to help this individual from that public health perspective. Um, this slide, really just talks about these overarching goals that this approach, public health approach to public safety, or a continuum of care, it really speaks to the reform efforts that we're talking about across the country, whether it's criminal justice reform, but really person-centric view to try to help meet those needs without creating an extra burden on individuals. It has been something that creates an opportunity to also be fiscally responsive to meet the needs, and it also addresses public safety. Part of it is freeing up public safety to address the violent crime, the property crime, and the traffic safety issues, but also making sure that our focus is connecting people to the help that they need while holding individuals accountable for the crimes that they would have been involved in on the violent property and traffic safety issues, and thus improving overall safety for our entire community. I think it's critical to utilize evidence-based programming. I think this goes often without having to be said, but it is very important that we measure the difference between effort and effect. We want to make sure that we are providing the right type of support for people in need, making sure that they're connected appropriately, balancing that approach with the accountability on the other side of the spectrum here, and meeting all of the community safety needs, not just relying on what makes us feel good, but data and evidence to say what's working and what's not working. Because there may need to be adjustments to programming based on the effectiveness. Here's just a quick guide that kind of shows these increases in calls for service that we've seen kind of leveling off a little bit here. CIRU, that's our crisis intervention response unit. So these are our co-responders. It shows the number of contacts that they've had here in both 2019 and in 2020. Similarly, making sure that these responses are in the right place. As you can see, Police District 6 has the most crisis intervention response unit calls for service, and you want to make sure that you match your co-responders, your STAR program, your alternative responses into the areas where they can create the greatest need. Also, you break down that data as to what types of calls for service we're seeing: welfare checks, suicidal parties, disturbance, threats to injures, domestic violence, for example. So data is critical in both creating that program and then monitoring the effectiveness of the programs that we have. Again, STAR gets the most attention. Carly is somebody that was part of our co-responder team originally. She is a tremendous leader, day one, helping to get this program off the ground. Now she runs the program for the city. She lives it, she breathes it. She was the co-responder on the STAR van when it started. So these are the types of calls that we would send folks to, or the STAR van to. And again, the key here is that these are nonviolent or calls that don't have weapons. The data pointed us to where the service delivery would be best effective. This is our District 6, as we indicated, the downtown district, and then an area on South Broadway where we also see some significant challenges. Again, time of day, day of week was looked at when we could have the biggest impact in order to get the STAR van where they could help the most, and that's what data pointed us towards. The STAR van itself can be assigned for calls for service through three different mechanisms. An individual can call 911, and calls are directly dispatched to STAR. That's about 42% of the calls for service during our pilot phase there. And something that I believe is very telling of this program and the buy-in from our officers that previously had been tasked with a lot of this work is that bullet point number 2, uniform response, independently request the STAR van to respond to the scene. This was 34% of the time. Nearly 35% of the time, the STAR van call was actually generated by a police officer, meaning the officer identified that the person was in need, there was no weapons, there was no violence, and that this could be better handled, more appropriately handled by the STAR van. And they did the handoff to STAR to follow up with the call. And then lastly, the third mechanism for a call for service is self-initiated. A STAR van is out there in the catchment area, in the area of greatest need, and 23% of the time, the STAR van was able to see a person in need, pull over, and start offering those services. Here's a little bit more on the response density. So one, we identified where we thought those responses would be necessary. The heat net, based on the data, shows where those occurred. The one thing on this slide that I do want to point out is that, again, we looked at citywide, the types of calls that were coming in. What is the potential for this type of program? And what we identified is an alternative response like STAR could potentially handle about 2.8% of the Denver Police Department's call load. This really speaks to that or and conversation that we have. If we're focused on better outcomes, then this is certainly an and. We want officers freed up as much as possible to address the increase in violent crime, property crime, and traffic safety issues. And we want STAR available to handle this 2.8% of the calls for service. This is great. What I also would point out is during this exact same time period, our overall workload as a police department increased by 6.2%. So our calls for service, total calls for service also increased. And that's why this truly is an and, not an or. A couple more data sets here as far as the breakdown by week. Obviously, weather has an impact on what this type of response looks like. Some of the incidents by problem type, this just helps guide that decision making on where and when to place STAR vans, and then part of the evaluation in order to make sure that that this is working. This measures, again, those types of calls and then who responded, whether it's the crisis intervention co-responder program or the STAR van. And people experiencing homelessness, we are seeing great outreach and support from the STAR van as indicated by this bar graph. However, the co-responders still have a lot of assistance that they provide as well. Here, again, just showing kind of how the breakdown of the types of calls, mental health related calls, and who is handling which types of calls for service. All of these last couple of slides are critical for identifying when best to apply the resource. Is the resource being most effective? How would future deployments look like, day of week, time of day, part of the city, and what types of calls? This data has really helped us identify when and where to best place the STAR van, as well as guide the expansion conversations and direction. As we wrap up here, critical to the success of launching an alternative response or even building out your co-responder program or outreach case coordinators is engaging with the community and our subject matter experts early and often. I can tell you that our process, there were a lot of aha moments when you would listen to a mother of an individual who has a child with significant mental health challenges and hear directly from that person how things are working or not working can really guide decision makers in how to create the best programs moving forward. As part of the last part, or the last part of the slide presentation really focused on data. It's critical that with these limited resources that we are handling the right types of calls. STAR vans or alternative response in and of itself is not a crime prevention or crime reduction strategy. It is about better outcomes, and data helps us identify when to deploy and utilize alternative response like STAR, or when it's best to utilize a co-responder program and how to follow up with outreach case coordinators. One of the areas that we think is critical is begin with the end in mind. Start with building your evaluation program on the front end. That way you can measure the success and make those changes as necessary to create the greatest level of effectiveness on these types of programs. And one area that was very beneficial for us was kind of that foundational approach that we had with co-responders with backgrounds in CITs, CIT training, that our officers were bought in. They bought in pretty quickly to this. We also have to communicate with our community and elected officials. Some folks will see alternative response or STAR vans as the replacement for police or a means to an end for a slogan that they want to advance. The key to all of this is better outcomes. You need to focus on better outcomes for people in crisis and having a continuum of care that includes co-responders, alternative response, and the follow-up piece, case managers, I believe gives us the greatest opportunity to meet those needs as well as address the enormous challenges that our communities are facing with regards to violent crime, property crime, and traffic safety. So thank you so much for your time and attention. We have and will communicate or share with anybody that's interested in developing their own programs, our experiences on what's worked and what has not worked. Thank you.